Hi, everyone, and good afternoon. I'm Bentley Ponder, Deputy Commissioner for the Quality, Innovations, and Partnerships Division, and I think we're ready to get started. Before we do, I'm going to check in with our support from UGA. And Michael, is everything good for me to start the presentation and to start going?
Yes, it is, Bentley.
All right, well, thank you. And good afternoon to everyone. Again, I'm Bentley Ponder, and I just have to say I'm really excited to be here. We've got some great information that we're going to share with you, and we really hope that many of you hear things today that inspire you and say, I can't wait to apply for that, and we hope that we'll be able to work with you soon. Before I get started and go through the agenda, I do just want to introduce the colleagues that I have on the panel with me. So we have Laura Wagner, who is our Director of Community Outreach and Partnerships. Hey, Laura. And Laura's going to be talking with us about some of the grant opportunities. And then we also have Jill O'Mara. Jill is our Community Coordinator, Partnership and Project Manager. I think I have that title somewhat correct. Both are part of the QUIP division, and she's going to be talking about some of our grant opportunities too. We also have Shana Funk and Sonia Steptoe, who are working with us in both research and communication and helping with support. So thank you, Shana and Sonia. And then, of course, we have Susan Adams, who is our Deputy Commissioner for Pre-K and Instructional Supports and oversees all of our PDG work, which, as you'll see in just a second, funds this. And she's available to answer questions as well. You may have heard me at the beginning mention UGA. So one of our partners in this project is faculty from Carl Vinson Institute of Government at University of Georgia. And here we have Dr. Melinda Moore and Dr. Teresa Wright, who are working with us on this project. So thank you all. And again, thank you all for joining. And I don't know, Melinda and Michael, I can't see from my screen. Do we know how many? Oh, I can see. There it is. So it looks like we have over 200 participants today. So again, welcome all and glad you're here. So just so you kind of know what to expect with our presentation today, in just a second, I'm going to provide a big picture overview of 3 different grant opportunities that we have just announced this week. And then we're going to go into a really deep dive with each one of those grants. So Laura, that I just mentioned, introduced a second ago, is going to talk with you about our 2Gen innovation grants. Then we're going to turn it over to Jill, who's going to talk about our trauma responsive care grants. Both of these are extensions of grants that we've offered in the past. And then I'm going to come back and talk about a brand new opportunity, our community impact grants or community transformation grants, which I think you'll be really excited to hear about. Afterwards, Laura's going to provide a little bit more detail around our application and grant logistics. And then we hope that we have time and we built in time to answer as many questions as possible. We will answer those at the end. If you want to go ahead and put questions in the chat box, Melinda and Shana and Sonia and Teresa are working to get all of those categorized, and we'll get those to us. And for those that we cannot answer today, we're going to have an FAQ that we will put up this time next week that will go into detail with all of these questions. We know you're going to have a lot. We hope to answer as many as possible, but just go ahead and put those in the chat, and those we don't answer today, we'll be able to answer within the next week. All right, so let's talk about what these grants are and give a big picture overview. So first of all, that these grants are funded and aligned with Georgia's preschool development grant. So for those of you that aren't familiar with this, in 2019, we were awarded an $11.2 million preschool development birth through 5 renewal grant, sometimes referred to as PDG birth through 5. This was actually the second PDG grant that we had been awarded. We were awarded a development grant the year prior to that. Susan and I do a lot of work within this grant, and what it does is it provides us a great opportunity to strengthen our system level, our birth through 5 system level framework, and align those critical birth through 5 services. And as you see with each of those grants, that fits in with that framework. A key activity of our PDG activities has been our needs assessment. And while I know that's not published yet, you'll see some of the results from that and how they feed into the grants, and those will be published soon. I think we just had our needs assessment approved, I want to say either last week or the week before, so we'll have that out pretty soon. And then the PDG, just so everyone knows, is the primary funding source for these opportunities. So in just a few minutes, we're going to go into much more of a deeper dive with what these grants are. And what you'll see are there's three different buckets of grants. And I alluded to this a little bit in the discussion of the agenda. So first, we're going to talk about our 2Gen innovation grants. And in that bucket, we have a capacity building grant that provides up to $10,000 per grantee, and an implementation funding, which is close up to $25,000 per grantee. We also have our trauma responsive care grants, and those are up to $10,000 per grantee. And then those community transformation grants that I mentioned, up to $75,000. It's a really important point, and we're going to stress throughout the presentation that these are collaborative grants, and each grant opportunity requires the creation of a collaborative team that will implement the work. So while each grantee will have a lead agency that oversees the managerial and financial functions of the grant, it really is a collaborative effort. And so to receive one of these grants, there has to be demonstration of this collaborative team. I know we'll have a lot of questions about this, and we'll go into more detail and provide more guidance in that FAQ, but each grant requires a 30% in-kind match of funding and or services. And so that would be on top of the grant award. And I know a lot of you have experience with that and know what qualifies for matches, but we'll go into more detail with that in just a few minutes. Just a couple of other key points here. So some of our key partners with this are GEARS, the Georgia Early Education Alliance of Ready Students, and they'll be working with us on the evaluation. And I know many of your staff are on the call today, so welcome. And then, of course, I mentioned our CVIOG partners. The applications and the letter of interest guidance are posted on our website, and there you'll see the link. And then, to go to what's always asked is pretty quickly, if not today, over the weekend or first thing Monday morning, we'll post the webinar recording. We'll have the slide deck posted, so you'll be able to see those links through that. And as I mentioned before, we'll have an FAQ document that will be posted by Friday, February 12th. So before I turn it over to Laura, let me just kind of highlight why are we doing these grants. Again, it's part of our PDG activities. And what we wanted to do with this opportunity is to increase those community level supports that we can offer for Georgia's children birth through 5 and their families. We know many of the innovations happen at the community level, and we want to do everything we can to support them. We also want to, provide a catalyst for creating, additional community collaboration, and hope that we're providing ways for this to be sustainable. We want to create opportunities for communities to innovate at the local level, and we know that these grants will do that. We also want to have additional research and evaluation. Those of you that know me know that that's where a big part of my passion lies. And so that will help us, see how the grants can have more impact, and hopefully then, to get to my last point, our blueprints for things that we can then expand or take up to scale. So really excited about those. I hope those make sense. And just real quick before I turn it over to Laura, you can see what the timeline looks like. We have these dates embedded throughout the presentation, so don't feel like you've got to write that down, but just know that on March 1st, the applications will be due for the 2Gen and trauma responsive grants. And then on March 15th, the letter of interest will be due for our community transformation grants. So I am right at my time. We have timed this very carefully to get through all the material, so I'm going to turn it over to my colleague, Laura. Hey, Laura.
Hey, Bentley, thank you so very much. So I am very excited to talk with you all this afternoon about the 2Gen Innovation Grants. So some of you all may already be aware, but this is actually going to be our 4th round of 2Gen Innovation Grants. These grants were initially funded by DECAL to a small set of communities several years ago as part of a funding opportunity that DECAL was granted called the Parents and Children Thriving Together Initiative, in partnership with the National Governors Association and the Center for Law and Social Policy. And so we're just really thrilled to be able to build on the momentum that we've been gaining in Georgia as a result of those first 3 communities that started as 2Gen Innovation grantees. So just truly thrilled about this particular opportunity. So what these grants are all about is essentially encouraging communities to pilot or expand community strategies that connect early learning programs to post-secondary programs and workforce programs in a system at the local level. So really system building at the community level is what this particular grant and the other grants being discussed this afternoon are all about. Next slide, please. So you might ask, what is a 2-generation approach? It is an approach that focuses on the needs of the whole family rather than just considering the needs of the child or the needs of the parent. It's considerate of the unique needs of the entire family all at once. There are 2 separate grant opportunities for these 2Gen Innovation grants. The first is capacity building at $10,000 each, and implementation funding grants at $25,000 each. Dependent on the pool of applications, we intend to fund up to 5 capacity building grantees and 4 implementation funding grantees in this particular grant cycle. In order to be eligible for such a grant, an organization needs to have a 501c3 or needs to be a government entity such as a state agency, county government agency, or city government agency, or a public college institution or public university. The timeline for this, as mentioned by Bentley, is that these applications are due close of business on March 1st, 2021. We intend to announce the awards no later than April 1st, and we will fund these grants from May 1st to April 30th of 2022. And we just put the link in the chat box for where you can find all of these RFPs. A little bit more detail on the capacity building grants include that we expect 3 primary objectives from our capacity building grantees. And the first is really critical in that we expect for our grantees to develop a collaborative team with representation from both adult serving and child serving categories. This is truly my favorite element of these particular grant opportunities, is that this is a wonderful opportunity for new partners to forge important new pathways ahead in support of the children and parents that they serve. So we require representation from either a technical college, institution, or a university system school, and or a workforce development board, as well as representation from the child serving category in that either a quality rated childcare program with a significant number of children receiving the Child Care and Parent Services Scholarship or CAP, or the inclusion of a Head Start or Early Head Start grantee. We also expect from our capacity building grantees that they conduct a comprehensive community needs assessment, looking forward toward potential implementation of projects that can be discovered as part of this community needs assessment in the future. And then lastly, family voice is critically important in all of the work for each of these community grants, but we expect that from our capacity building grantees in particular. Next slide, please. For our implementation funding grantees, these awards go up to $25,000 to a community with an already established 2Gen coordinating body or leadership body in order to implement a project, policy, or initiative that will positively impact the whole family, multiple families in local communities, and meet at least one family outcome measure from Ascend's 2Gen Outcomes Bank. We also, similarly to the capacity building grants, we require that there be representation from both the adult serving and child serving categories of organizations in your community. Next slide, please. So some ideas might include the following, but we want to also hear from you all as to what your creative new ideas and new strategies are. So please don't consider this as an exhaustive list of what we're looking for with 2Gen innovation grant ideas, but just food for thought might include the hiring of a part-time career coach to meet virtually with parents at childcare programs to help them connect with workforce training opportunities and post-secondary options in their communities, to host virtual cross-training opportunities for student parents and/or local representatives of the Child Care and Parent Services or CAPS program, TANF program, SNAP, and WIC, and other assistance programs at the state and local level that allow for representatives of those programs to meet one another and learn about each other's programs. You could also consider partnering with a Head Start or Early Head Start program to offer parenting classes and family engagement opportunities to parents who are college students. You could consider developing a new student orientation or boot camp for student parents that is especially considerate of the needs of student parents on campuses. Or you could create a family resource center on a college campus. We do actually have a very successful 2Gen implementation grantee currently that has done just that. Some suggested resources are as follows, and we will be posting this webinar, so you're welcome to reference this and follow up. But you'll see resources from Ascend at the Aspen Institute, from the Ohio State University, from the Institute for Women's Policy Research, as well as Wellesley Centers for Women. And then lastly, for me, it's really important always for us to mention the resources that we at DECAL make available to community partners and childcare providers across the state, as well as families. Families or community organizations can look for quality rated childcare options in their communities by visiting qualityrated.org. Also, CAPS is a critical resource in this work. Many of you on this call are likely already aware that the CAPS program transitioned from DFACS over to DECAL in 2017, but also as part of this transition now, we have approved activities that include the enrollment and post-secondary education at technical colleges and at university system institutions in Georgia. So CAPS is a critical resource. Lastly, the DECAL Community Partnership Team that Jill O'Meara leads, who I will introduce in just a moment, is also considered as a wonderful resource to community organizations across the state. NANA grants and Boost Child Care scholarships are also two alternative scholarships that you might consider as a supplement to your community strategies. And then lastly, it's important to note that any family across the state of Georgia can call 1-877-ALL-GEORGIA-KIDS for a referral to a quality rated childcare program free of cost to them. So please do also consider that as a key tool in your work. All right, with that, I would really like to turn it over to my colleague, Jill O'Meara, who will be talking with you all this afternoon about the trauma responsive care grants. Thanks, Jill.
Hi, thank you, Laura. I'm sorry, I was having some technical issues just a second ago. So good afternoon, everyone. I'm really excited to be here with you today to talk about the next grant opportunity on our agenda for trauma responsive care grants. It is really important for us to emphasize that all of these grants focus on community collaboration. So please keep in mind that we are looking for compelling proposals that will strengthen local supports and services for the birth to 5 population across the state. You've already got the slide, thank you. I would like to take a moment to provide you all with some background information on this particular grant. Through funding from Georgia's initial preschool development grant, planning grant in 2019 that Bentley mentioned, DECAL offered the first round of trauma grants. We called those Early Learning Leadership Collaboratives, or ELLCs. These grants were awarded to 6 counties across the state. They were awarded to Baldwin, Bartow, Cook, Elbert, Evans, and Troup. We had one of these in each of DECAL's 6 administrative regions. Through a non-competitive grant process, DECAL had the opportunity to learn a lot about what makes this type of work successful at the community level. Now for the 2021 funding cycle, we are pleased to announce a second round of grants. Yes, these are competitive grants with a new name and focus around trauma responsive care. So, what is this grant opportunity about? The goal for this one-year grant opportunity is for you to think about a new way of collaborating. Think about how you and a collaborative team could use a trauma responsive approach to identify the impact of trauma on children, caregivers, and families, and integrate responsive practices to support resiliency. This grant opportunity offers a one-year award up to $10,000. It is also important for us to note the eligible applicants for this funding. I can see in the chat box that a couple of you have had questions around this, but there are 2 types of organizations that are eligible to apply for this grant. Nonprofits with a 501c3 or government entities, such as state agency, county or city government agency, public college or public university, or school system. Now, there are other types of organizations that may also be interested in applying for this grant opportunity, but are not currently a 501c3. They could be funded through this grant, but they cannot be the main applicant. They would need to partner with an organization that is eligible to apply, such as a nonprofit with a 501c3 or a government entity. For the timeline, it's very similar to the 2GEN, or it is the exact same as the 2GEN Innovation Grant timeline. The Trauma Responsive Care Grant applications will be due on March the 1st. Awards will be announced no later than April the 1st, and the funding cycle runs May 1st through April 30th of 2022. As a reminder, each of these grants will require a 30% match. So first, for this particular slide, first I should inform you that there is a lot of information on this slide, all of which is outlined in the RFP, so please don't feel overwhelmed. But for this grant, we are looking for 3 things to be accomplished with this funding. The first thing we are looking for the grantees to do is to build a cross-sector collaborative team, one that will increase understanding and strengthen capacity related to trauma responsive care for the birth to 5 population. For this collaborative team of 6 to 10 community stakeholders, you will need representation from the following organizations: Georgia Department of Public Health, Georgia Division of Family and Children Services, Georgia Family Connection Collaborative, Georgia's Pre-K program, Head Start and/or Early Head Start, local child care program, local school system, and local law enforcement. Each local cross-sector collaborative team will participate in 3 virtual trainings together. The training topics include understanding the impact of trauma on children and understanding the impact of trauma on brain development. For the 3rd training, you choose one from the following list: building resilience as a response to trauma, recognizing and managing secondary traumatic stress, or psychological safety, a pathway to resilience. In addition to these trainings, the cross-sector collaborative team will participate in 3 virtual coaching sessions again, with our partner, Georgia State University. The second objective is to develop and implement a community-based trauma-responsive action or project plan. The development of this plan needs to be clearly defined in your proposal by focusing on the grant guidelines in the RFP. The implementation of your plan will focus on using a trauma-responsive approach to identify the impact of trauma on children, caregivers, and families, and integrate responsive practices to support resiliency. That is the first two objectives that this funding needs to accomplish. For the third objective, you will need to tell us what your plan is to disseminate trauma-responsive local resources to families and providers related to the trauma-focused strategies you outlined in your project plan. Yes, we know that there are very few people that are gathering for large events due to the pandemic, and for this reason, you will need to be creative and think outside of the box to accomplish this objective. Next slide, please. If you're interested in writing a proposal for this grant opportunity and looking to support successfully planning of your community-based project plan, join us Tuesday, February the 9th at 1 p.m. for this webinar. DECAL will provide an overview, but Georgia State University will provide an in-depth training that includes strategies and resources for you to use in the development of your plan. And remember those 6 ELLC grantees I mentioned earlier from the first round? During Tuesday's webinar, you will have an opportunity to see video highlights from them talking about their success stories. Next slide. Next, we want to share with you some potential trauma-responsive grant ideas. And remember, these are just ideas. You could host a community event to promote your vision of becoming a trauma-responsive community, or support opportunities to connect families impacted by trauma with community-based services. You could distribute trauma-informed resources and books for teachers and young children, offer mindfulness trainings for parents, home visiting partners, and teachers of young children, or collaborate with organizations to offer trainings that will best prepare teachers to work with children that are unfortunately impacted by trauma. Next slide, please. Now here we offer you some resources that you may find useful in the planning of your proposal. From National Child Traumatic Stress Network, services for families and of infants and toddlers experiencing trauma, Greater Good, Resilient Georgia, Building Community Resilience for Children and Families, and the ACES Connection. Last slide, please. Because we are a state agency that handles birth to 5 early childhood education in Georgia, we want to ensure that you have access to supports for the birth to 5 population. In just a few minutes ago, Laura mentioned some of these same resources that will be very helpful for you from DECAL. And additional resources you could look into are coming from GEARS, which is Georgia Early Education Alliance for Ready Students, or Get Georgia Reading, Kids Count Data Center, Voices for Georgia's Children. And so we hope that you have a few moments to go to look at those resources as you plan your proposal. We want to remind you that throughout this funding cycle, we will provide you with trainings to be trauma-informed, but this grant opportunity is geared more towards becoming a trauma-responsive community. We want you to be successful in this grant. So please feel free to reach out to us if you have questions. But for now, I want to say thank you for tuning in today to hear about our community impact grant opportunities. And to keep it going, I will turn it over to Bentley now to talk about the community transformation grants.
Thank you, Jill. That's great. I have to say that's the second time today I've heard you do that, and both times I've learned something. So great. That's really wonderful. And I don't know whether anybody saw this or not, but there might have been a blip in the screen sharing because earlier when I was advancing the slides, I accidentally clicked on the quality rated link. So I will say that it works. And if you're looking for quality rated childcare, that's a great link for you to use. So thank you, Jill. And let's move on to our third grant opportunity, our community transformation grants. Unlike the trauma responsive care that Jill just talked about and the 2Gen innovation that Laura talked about previously, these are brand new grant opportunities that we have created and developed specifically around our PDG grant. And I will say this, we're still learning some things with these. So I think there's still some things we're figuring out about how all this would work. I'm really excited about these opportunities, but just know that there may be some questions that we're going to have to get back to you, and that we're still figuring out the best way, to move forward. So what are community transformation grants? So again, it's a brand new grant opportunity that will address local needs related to a community's birth through 5 population. These grants are actually up to $75,000, and that cost is for you to design and implement a project. This grant duration is actually 18 months, so from July 1st, 2021 till December 31st, 2022. The faculty from CVIOG will be providing technical assistance from the application process through project implementation, and I'll talk a little bit about that in just a second. Rather than submit an initial application, what we're asking communities to do is to submit a letter of interest. Based on that letter of interest, we'll invite up to 12 communities to submit a formal application, and that'll be when that technical assistance from CVIOG kicks in. We expect to award 6 of these grants, so we'll invite up to 12 communities to submit that formal application. And then basically you will select one of 9 needs to address with your proposed project. And these 9 needs were identified through the needs assessment that I talked about at the beginning of the webinar. So what are these identified needs? And so as I mentioned before, there's 9. So we've got 5 on this slide and 5 on the next slide. So, increasing access to high quality early programs for infants and toddlers, increasing access for dual language learners, increasing access for children in rural areas, supporting children with persistent challenging behaviors to reduce suspensions and expulsions, reducing food insecurity for children aged birth to 5 and their families, strengthening and coordinating early learning services for children in foster care, providing mental health services for the birth to 5 population and their parents and caregivers, providing enhanced services to young children related to the early identification and treatment of developmental delays and disabilities, and then supporting us developing a system of care to support children birth to 5 and their families who are experiencing homelessness. And we realize that these needs are, of course, interrelated, but we're going to ask communities to pick one of these 9 and develop a specific project to address. Now, something a little bit differently that we're doing with this grant opportunity that we haven't done in the past is we're asking communities to first submit a letter of interest that will then be scored, and based on those scores, and to ensure that we have geographic representation across the state, and that we also have representation across those 9 focal areas, we will then determine, up to 12 potential grantees that will submit a formal application. If you look at what some of the suggested content in that letter of interest, it's really 3 different buckets. And again, all this is located under guidance on the website that we shared earlier. So the first thing we would ask you to do is in your letter of interest, identify a focus area for proposal. So this would be where you would identify the specific need that you're addressing in that focus area. And then we would also want you to use some high-level community data to justify that need. So maybe you would use poverty rates or unemployment rates, or, there's, some of the other data points that are embedded in those sources that Laura and Jill shared earlier, and that you can also find through some of our other data sources as well. Then we would ask you to include in your letter of interest your local ECE partnerships. So who are the community partnerships who will participate in this? And then while we know that some of these partnerships may be new and this is a new opportunity for collaboration, we do want you to provide evidence to the quality of the partnerships. So what are some existing partnerships that you're tapping into? And do you have, experience as a community in developing these partnerships? And then last but not least, you would include a high-level project plan. We know that there'll be a lot of design between the letter of interest and the application phase. And we also know that after you receive funding, you would still be doing some design, but we want in this letter of interest to have at least a high level idea of what you are proposing to do. So how will you address the unique needs of your population? What are those evaluation metrics? And, potential insights. What do you hope to learn from this that may be of use at the state level or federal level or with other communities in Georgia? So we know that some of those, you can't answer until you get into the project, but at least we want to see in the letter of interest how you're thinking through those things and what are some of the questions that you hope to answer. And again, this guidance is listed, in the on our website. So unlike our other two grants where we had existing grantees where we could, offer some suggestions of what other grantees have done, this is a brand new opportunity. So in preparing for this, I took one of the 9 areas, the 1 needs, specifically food insecurity, something that honestly I've been thinking a lot about during the pandemic and something that it weighs heavily on myself and many of us. And so what could this look like if you were addressing this? And again, these are just ideas. And really with this, it's just some brainstorming on our part. But some of the activities you could maybe think of. What's a plan? What are some strategies for expanding WIC services for families like on-site eligibility or marketing and early learning programs? What are some plans that you could do to extend services to support families from children birth to 5? So maybe there are services that are for different age groups that then you could extend to birth to 5. What are some maybe new volunteer opportunities and strategies that you could use the grant to help convene and get off the ground, like a community green market or community garden? Maybe there are nutrition classes that you could offer families and stakeholders in your community. One of the things that I saw was a monthly walking tour around community resources that could help families. Again, this is an opportunity to really think of outside of the box and really use those collaboration skills. Maybe you could identify food deserts and create or expand public partnerships that could help address those food deserts. Some helpful hints as you're putting together your letters of interest. How do you ensure that your collaborative partners are all on the same page in terms of your identified need? In other words, what we hope that communities don't do is say, okay, well, I have this idea and I have this idea, so we're going to try to just put it all together and address multiple needs. But to really pick one of those 9 needs and zero in on that. So I think it's going to be important to make sure that you're all on the same page. And then, to make sure that you're able to use data. Now, part of the TA that CVIOG will be providing will be supporting you in using that data. But how are you identifying the community populations that are most in need of food insecurity support? How do you identify what type of support is most needed? I know there aren't perfect data sources. I know that part of this project may be collecting additional data, but what are some of the best available data that you have right now that can help and justify this project that you could include in your letter of interest? Again, these are just ideas. This is just some brainstorming with one of those 9 needs. If you go back, you can see that there are the 9 needs here. What's one that would be best suited for your community that you could write and plan a project around? And that's what we're looking for you to do with that letter of interest. So just, in terms of the eligibility, government entities, local school systems, and nonprofits would be eligible to apply. Others may be able to apply under that umbrella, but one of these would need to be the lead. And the timeline for this is a little bit different than the other 2. The letter of interest is due on March 15th. On April 15th, communities will be invited to apply. Those applications will be due May 14th. We'll notify you June 9th, and July 1st, the grants will begin, and December 1st, 2022, the grants will conclude. Again, just really excited about this opportunity. This is brand new to PDG, brand new to DECAL, and we can't wait to see the different projects that we'll be able to support. And with that, I'm going to turn it back over to Laura, who's going to go through some logistics before we answer some questions. Hey, Laura.
Hey, thank you so much, Bentley. All right, so we wanted to go ahead and talk through some of the questions that we thought might be coming to your minds as you listen to information about these particular opportunities. So the first question that came to our minds in thinking about this was that you all might be wondering if you could apply for all 3 grant opportunities. So the short answer is yes, but we would encourage you all to think very carefully about the grant opportunities that you would like to apply for that are considerate of both the genuine needs of your communities as well as the data that supports what those needs are. And in complement to that, what the capacity of the organizations are in your community that would be well poised to meet the needs of the families with young children in your community. And as a reminder, each of these grants are intended for serving and supporting families with young children ages birth to 5. So primarily because we want to ensure geographic and organizational diversity amongst our grantees, we would encourage you all to think very carefully about the grant opportunity that you would like to apply for, because we will likely only fund 1 grant for successful applicants. All right. The next question that we wanted to answer for you all is how would I know which grant opportunity might be right for my community? And again, just please be mindful of the data that demonstrates that local need and the community capacity that you have there to support it. We wanted to talk with you all also a little bit about the match requirement. As mentioned very early on in this webinar, there is a 30% match requirement for each of the 3 grant opportunities. So we are requiring this match in order to allow more partners to be involved and increase the impact of limited federal funds here. What counts as a match for these grants? Well, cash and third-party in-kind contributions primarily. And these must be verifiable and they cannot be included as a match for any other federal award. These must also be necessary, reasonable, and allowable and must be included in the DECAL approved budget. Last, related to the match here, how will you document a match? The match documentation may include a certification of hourly rates for employees, invoices documenting the purchase of supplies or equipment, or other documentation as requested by DECAL. All right, next slide, please. Okay, so what is the process for receiving funds from DECAL? So the fiscal agent for each of these grants will front the cost for each purchase, and then DECAL will reimburse for costs incurred by the fiscal agent, likely on a monthly basis. So these are based on cost reimbursement. What are approved uses of funding and what are prohibited uses of funding? Ultimately, we are going to work with selected grantees of each kind to review budgets as part of our contract negotiation process with organizations prior to each grant term. So before any contract is executed with organizations, we will review and approve budgets. But to share a little bit more detail as you're thinking through what might be in your budget, please consider that prohibited uses of funds generally include food items or meals, childcare expenses for families, regular tuition or education supplies for families, children, or student parents, salaries and or benefits for staff or volunteers, or capital expenditures such as building improvements. All right, so how will we be evaluating the success of our grantees? Well, our 2Gen Innovation grantees and our Community Transformation grantees will work collaboratively with GEARS, who we mentioned earlier on the call, to develop an evaluation plan that allows for lessons learned and successes to be documented for similar efforts in the future. That's really what all of these grants are about, is to discover lessons learned that can be applied at the state level. Lastly, what kinds of technical assistance and resources can grantees expect? Trauma responsive care grantees will be supported by the Child Welfare Training Collaborative at Georgia State University, as Jill mentioned earlier. Our 2Gen Innovation grantees and our Community Transformation grantees will be supported in their evaluation efforts by GEARS. Community Transformation grantees will receive technical support from the Carl Vinson Institute of Government at the University of Georgia, who is also on this call with us this afternoon. And then last but not least, our team, the DECAL Community Outreach and Partnerships Unit, will provide ongoing support and assistance to all grantees as needed. And we look forward to that. All right, I think that's my last slide there. Thank you. Bentley, I think you're muted.
I am, thank you. I've done that 3 times this webinar. So now comes the fun part where I'm gonna go through the questions and try to facilitate and read questions at the same time. So we'll see how this works. First of all, one of our friends, and I don't see the question right at this moment, but said, thanked us for doing the webinar. So I just want to give a shout out back and say we really appreciate that and we are excited to be here. Laura, I also saw a question that talked about how many grants that we will be offering. So I wondered if you could address and just list how many grants we're offering for each of the 3 buckets.
Oh, gracious. All right. So let's see if I can do this. The 2Gen Innovation grantees, we intend to award up to 5 capacity building and 4 implementation grants there. For the trauma responsive care grants, we intend to award up to 9 grants in this grant cycle. And then lastly, for the community transformation grants, our largest grants, we intend to award up to 6 community transformation grant awards.
Okay, perfect. And then Susan, if you don't mind, I'm going to ask you to step in and answer this with Laura, but we are getting a lot of questions about the match. So I appreciate you jumping in here, Susan. I know we talked a lot about that, so I thought maybe you could address some of those.
Sure. Hi, everybody. I'm Susan Adams. I'm a Deputy Commissioner here at the Georgia Department of Early Care and Learning. I'm happy to help you answer some of your match questions. I'm not quite sure why the former preschool teacher can answer this, but I'm going to give it a go. Actually, I've had a lot of experiences with grants. So as you think about your match, you want to think about in-kind services or funds that would go towards your project. The federal requirement is 30%. So you could, look at giving us those actual dollars, but I'm going to guess most programs want to look at an in-kind match. What you have to do is think of a couple of different things. A lot of federal grants require a match. So the funds that you put towards any of these grants can't go towards any other match. So if you're matching another grant, you can't do this. But you can also think about what kinds of things need to happen in order for your grant to be implemented successfully. If you're going to do trainings, are you going to have training space, and what is the value of that training space? That could be used as an in-kind match. Are you going to, with this money, you can't provide food, but if at some point you were doing a face-to-face activity and you were going to choose with your own funding to do a meal or snacks for a training for families or teachers, you could use the money used towards that as an in-kind match. If you have other contractual services that you're working with, that you're paying with your own local funds, that could be a match. There have been some specific questions around, can you use your Family Connection grant? Potentially. I think if you have a specific question, the best thing to do is reach out to us and we can look at it. And we've worked through that 30% match with grantees to make sure that you understand what you can use and what you can't use, and then also what documentation we need. So we'll work through that with you. Another question about the funding that someone asked is this cost reimbursable? So these are federal grants, and our federal grants mean that they are reimbursable grants. These are for things that you've done. You submit your plan, it's approved, and then you'll be implementing it. And then you're going to submit invoices back to us, documenting the things that you've done, and then we'll pay based on that. We do try to look at some deliverables that are close to the front of the grant so we can get some money out to you, but you do need to think about that this is cost reimbursable. So you're going to have some seed money yourself, some money that you can use up front, and then we'll be reimbursing you for your expenses. Is there anything else with the questions, Bentley, that you want me to address around the budget?
No, not around the budget, but I will ask you a personal question. So of those, if you were leading a community collaborative and you had Susan's choice, which of those 9 needs would you want to address? I know we want to do all of them, but I'm just curious.
So as we look at those needs, 2 things that come to top of mind for me, and they're connected to ongoing needs that we see with young children and their families, but also probably connected to what's going on with the pandemic. Thinking about both supporting kids in building positive behavior and reducing suspensions and expulsions from early learning. That's a need to support people, our workforce, our families, in doing better for kids so that they're able to stay in their early learning programs. And then the second thing connected to that is thinking about services around infant early childhood mental health. That's been a hot topic. There was a legislative study commission. Our agency was recently funded a position to focus on this, and there's tremendous opportunity to think about the services and supports that young children need around building healthy mental health. And that starts when children are born. And that will help prevent some of those challenging behaviors that children may have later. And certainly during the pandemic, we see an increase because of the trauma that's going on in our communities. So I'm always happy to lend an ear to what I think would be a great proposal.
I know, and those of you that know me know Susan and I are good friends, but I promise you that was not planned. So that was completely off the cuff. So thanks, Susan. Jill, we're getting a lot of questions in the chat box about the webinar, I think on the 9th next week. So can you talk a little bit about that? And for everyone to know, I know that link to register for the webinar is in the chat function.
Yes, thank you for bringing that up. So the link is in the chat box. Please register. So this particular webinar will provide a DECAL overview, a little bit about, similar to what we've done today to talk about the trauma grants, but it also will provide an in-depth training to help support you on your project plans. And so the number 2 objective of the trauma grants is to make sure that you develop and implement a community-based project plan. So this particular webinar will help you to design that. Georgia State University with Child Welfare Training Collaborative, they will offer you the tools to be able to do that and lots of great resources. In addition to that, you will hear from the 6 previous grantees about their success stories. So there'll be some video highlights from them, which will be helpful. And it will be at 1 o'clock on Tuesday.
All right, thanks, Jill. And again, for everyone, that link is there, so please register for that. Jill and Laura, I think any of us could answer this, but we're getting some questions about can communities apply together for a 2-gen grant? Like, does this have to be, or I'm sorry, do counties have to apply together? So could multiple counties apply for one 2-gen grant? or could apply for these others. And we know that different counties have different needs. So Laura, how would you respond to that?
I actually think back to our early education empowerment zone days where we had great success with working with collaborative partners across county lines. And so I would apply that same, that same experience, hopefully, to the, grantee pool that hopefully we'll see in the coming weeks. I don't think that we're opposed to working with partners from different counties, just so long as those partners are committed to working together in a concerted fashion to support the children and families in their areas similarly and equitably.
Perfect. Thank you. Jill, anything that you would add to that?
No, except the fact that she's right on about the E3Cs and in working across county lines, especially when we didn't think it would happen very well, but we were very successful with it. And people want, and children cross over many times and from county to county. So we think it's, we'd love to see some proposals for it.
Right, that's
one
perfect.
Fiscal agent, but yes.
One fiscal agent, yes, thank you. And we are still getting questions about whether the webinar and the recording will be posted. And yes, absolutely. We hope to get it posted, later today or over the weekend, but at the latest, it'll be first thing Monday morning. I'm sure our IT department, if they're listening, is not happy with me saying by today. So, give us at least until Monday, but we hope to get it posted sooner than that. Laura and Jill, and maybe, with Susan too, we are getting a lot of questions from childcare providers asking if they can apply. And, I do want to make the distinction that these are different. This is a different grant opportunity than our stable grants. And our stable grants have, we've used from our CARES Act funding, and those have provided direct assistance, financial assistance to providers during the pandemic. This is different, and these are community collaborative grants. And while we certainly want childcare providers to be a part of these and to work as part of their collaborative, it's probably not best suited for them to be the fiscal agent for these grants. And it's certainly not something that an individual family provider or a childcare provider would apply for. Again, they can participate as part of the collaboration, but not necessarily as the fiscal agent or the lead entity for these grants. Again, there are the stable funds and other grants that go directly to childcare providers, but these are community collaborative grants. And Laura, you worked with this longer than I have. Did I say that? Anything you would add to that?
I think you're right on there, Bentley. I think just to echo what you said, we would definitely encourage family childcare learning homes and childcare learning centers similarly to be a part of the community collaboratives that are part of the grantee pool here. But these grants are for collaborative groups to support lots of families of children birth to 5.
Right, and a childcare provider, for example, who is a 501c3 could apply, but again, would have to demonstrate that it's part of a collaborative and not an individual childcare provider. Right. Just kind of looking. I know we've got just a few more minutes. Laura, anything more that you would add? I'm looking through the questions just to make sure that we've at least big picture. Oh. Someone asked, are there certain target communities that the grants are focused on? I know in the past we have identified communities. We've had our own little algorithm where we've, said, okay, these counties receive certain points. We don't have have target counties for these. So we're really looking at the quality of those applications. We are going to make sure that we have geographic representation with the grant awards. And for those transformation grants, we are going to look to see, to try our best to ensure that we have representation across those 9 different needs areas. Laura, I did notice we did get a question about, can communities apply for multiple grants? I know we talked about that.
Right, and the short answer is yes. However, DECAL will likely only fund 1 grant per selected organization. So we would just like to advise everyone listening to think very carefully about what you're perhaps best positioned to apply for.
Perfect. All right. Well, thank you to everyone. We're exactly at 3 o'clock. This has been great. We are really excited about these, and I think this is a good opportunity for communities. And I just have to say that I can't wait to be able to get out and travel around and see the great work that's going on at the community level. And with that, Laura and Jill, I'll let you have the last words and close us out. I don't know which one of you wants to go first. Jill, why don't you go first, and then Laura, you close us.
Sure. So I'm just going to remind everyone to look back at the RFPs, make sure you look at those timelines, and don't forget to include as much detail as possible in your proposals. We look forward to seeing them. So good luck.
And Laura?
I'm actually seeing one last question about the match here, Bentley, and if it's possible to call your attention and perhaps Susan's attention to it. I think it's a pretty important question. It's my understanding that the 10K grant is, and again, this is my understanding, is that it's $10,000 that can be reimbursed by DECAL, but an organization would have to match $3,000 to that $10,000 as a match. So it's really $13,000 worth of work going towards that particular effort. So
yes, hi, Laura, that is correct. I've collected some of the questions around the match, and we will be working on those for the FAQ. And there were a couple of things I want to research and make sure we have the right answer for you, but we'll make sure they're in the FAQ. But that is correct.
Thank you so much. But I would just echo all the enthusiasm and excitement that's been expressed already. Really thrilled to be able to read through proposals and see the fresh ideas that you all think of in terms of supporting the young children and families in your community. So thank you all for being with us today.
Thank you all, and everybody have a great weekend, and we hope to see and hear from you soon.